A low-carb diet for beginners. A low-carb diet is one that limits carbohydrates, primarily found in sugary foods, pasta, and bread. Instead of eating carbs, you focus on protein-rich whole foods and vegetables. Studies show that low-carb diets can result in weight loss and improved health markers. These diets have been in common use for decades and are recommended by many doctors. Best yet, there's usually no need to count calories or use special products. All you need to do is eat whole foods that make for a complete, nutritious, and filling diet. Learn more about low carb and how to use it for your personal goals below. 1. What is low carb? A low carb diet means that you eat fewer carbohydrates and a higher proportion of protein and fat. This can also be called a keto diet. However, not all low carb diets result in ketosis. For decades we've been told that fat is detrimental to our health. Meanwhile, low-fat diet products, often full of sugar, flooded supermarket shelves. This coincided with the beginning of the obesity epidemic and, in hindsight, was likely a major mistake. While the proliferation of low-fat products doesn't prove causation, it's clear the low-fat message didn't prevent the increase in obesity, and we believe that it has contributed. Studies now show that there's little reason to fear natural fats. Instead, on a low-carb diet you don't have to fear fat. Simply minimize your intake of sugar and starches, make sure you are getting adequate protein, or even high amounts of protein, and you can eat enough natural fat to enjoy your meals. When you avoid sugar and starches, your blood sugar tends to stabilize, and the levels of the fat-storing hormone insulin drop, which may make it easier to burn fat stores in the body. In addition, the higher protein intake and presence of ketones, if eating very low carb, may make you feel more satiated, thereby naturally reducing food intake and promoting weight loss. Studies show that a low-carb diet can make it easier to lose weight and to control your blood sugar, among other benefits. The basics: eat meat, fish, eggs, vegetables growing above ground, and natural fats, like butter. Avoid sugar and starchy foods, like bread, pasta, rice, beans, and potatoes. Eat when you're hungry and stop when you're satisfied. It can be that simple. You do not need to count calories or weigh your food. Health benefits of a low-carb diet. Why would you consider eating fewer carbs? There are many potential benefits, proven by science and supported by clinical experience, like these. Low carb and weight loss. Lose weight. Most people start eating fewer carbs to lose weight. Studies have shown that low-carb diets are at least as effective, if not more effective, than other diets. Low carb makes it easier to lose weight without hunger, and without having to count calories. According to recent studies, a low-carb diet can even result in burning more calories than other diets. Reverse type 2 diabetes. Low-carb diets can help reduce or even normalize blood sugar, and thus potentially reverse type 2 diabetes. As the American Diabetes Association notes, carbohydrate reduction of any level is likely an effective tool for blood sugar control. Low carb can also be helpful in managing type 1 diabetes. A grateful gut. Low carb might help settle a grumpy gut, often reducing symptoms of irritable bowel syndrome such as bloating, gas, diarrhea, cramps, and pain. Indigestion, reflux, and other digestive issues can sometimes improve, too. For some, this is the best part of going low carb and happens usually within the first few days, or first week, of starting the diet. Reduce sugar cravings. Are you struggling to stay away from sweet foods, even though you try to eat them in moderation? Many people do. A low carb diet can often reduce and sometimes even eliminate cravings for sweets. Bonus benefits: weight loss, shrinking fat stores, lower blood sugar, improved mental clarity, and a calmer digestive system are the most frequently cited benefits of low-carb eating. But some people experience even more improvements, some of which can be life-changing: lower blood pressure and other improvements in risk factors for heart disease. Less acne and better skin, fewer migraines. Possibly improved mental health symptoms, better fertility, and more.